Hi, Dr. Semenoff. This is Brittany Troxel, and this is my final presentation for the benchmark. This is my sister, Ashley Troxel. She's going to be helping me out today. And my specific area to look at is the lumbopelvic hip complex, and specifically a single leg squat, and looking at when the torso rotates in towards the leg that is on the ground. So first we're going to look at a single leg squat. I'm going to have you have your hands on your hips. You're going to be on one leg, and your other leg is going to be bent back. You just go down as far as you can. Okay? Okay, awesome. All right, so as we can see with the single leg squat here, the torso does rotate in, so that means that we have some overactive and some underactive muscles to look at. All right, and some of the overactive muscles that we have are the tensor fasciae latae on the same side as the leg that she is standing on, as well as the adductor complex with the same side, and the internal obliques on the same side. On the opposite side that is overactive is her external oblique, so the external obliques on her right side. And then some underactive muscles that we have are the gluteus medius and the gluteus maximus on the same side, and then on the internal obliques on the opposite side, and the external obliques on the same side. One possible cause for this impairment is because she has a desk job that she works at all day. So this will cause a weak gluteus maximus, and so that will overactivate her adductors at times and will overactivate her internal obliques, and her gluteus maximus is going to be weak. Okay, so the first step in the corrective exercise continuum is inhibition techniques, and the inhibition technique we're going to be using is self-myofascial release. So we're going to use the self-myofascial release on the TFL as well as the adductors. So what you're going to do first for the TFL is you're going to be on your leg that you are standing on for the single leg squat, and you're going to be across it on your hip, and you're going to hold any tender spots that you find for 30 to 90 seconds. Just rolling back and forth on it. The point of self-myofascial release is to release any knots that we have in the muscle to get it to relax, so that it can just relax and stop being overactive and tight. Did you find a tender spot? Okay. All right, and then the second muscle that we're going to be using SMR on is the adductors. So what you're going to do is on the leg that you are standing on, you're going to go ahead and just drape the inside of your thigh on the throat foam roller, and you're just going to be facing that way, and you're just going to be rolling back and forth until you find a tender spot, and then again hold that tender spot for 30 to 90 seconds, depending on the pressure. Okay, the second stage of the corrective exercise continuum is the lengthening stage, and what we're going to be doing for this is we're going to be doing static stretches of the overactive muscles again with the TFL and the adductors. So for the first one, and normally you're going to be doing 1 to 4 reps of these and holding for 20 to 30 seconds for each of the stretches. So for the first one for the TFL, what you're going to be doing is you're going to have your stationary leg back. You're going to be keeping your feet apart, and your back leg, rotate the foot out just a bit, and then you're going to have your left arm up, and you're going to twist and then twist your body and hold that for 20 to 30 seconds, and do that twice. And then we're going to be doing the static stretch for the adductors. So what you're going to be doing is basically just a side lunge. You're going to put your weight on your right leg, and you're going to be extending your left leg, making sure that your knee is kept straight. Make sure that you are bending over enough and down to make sure that you get a stretch on the inside of your upper thigh. Hold that for 20 seconds and do it twice. And what these static stretches are doing is we're just going ahead and we're making sure that we are lengthening these these muscles to increase the range of motion at the joint that the muscles affect. The third stage in the corrective exercise continuum is the activation stage, and what we're going to be doing first is positional isometric strengthening. So for the first one, we're going to be doing this on the underactive muscles, and the main ones are going to be the gluteus medius and the gluteus maximus on the same leg that she is putting her weight on. So what we're going to do first is we're going to be doing the gluteus medius, and we're going to be strengthening your left gluteus medius. So what I want to have you do is you're going to have lay down on your right side facing the camera, and what I'm going to do is I'm going to put pressure on your leg as it's lifted up a bit. I'm going to put pressure down, and you're going to resist me, but don't overpower me, okay? All right, have it abducted. I'm going to push down for 25% pressure, and then go ahead and just resist me for 4 seconds, and then 2 seconds in between. 1, 2, 3, 4. 1, 2. I'm going to have some more pressure. 1, 2, 3, 4, and then 2 seconds again. I'm going to have even more pressure. 1, 2, 3, 4, and then rest for 2 seconds, and then I'm going to have full pressure. 1, 2, 3, 4. All right, positional isometrics for the gluteus medius. Now we're going to be doing the positional isometrics for the gluteus maximus. So I'm going to have you on your stomach, and you're going to bend your left knee to 90 degrees. All right, and then you're going to go ahead and just extend your hip up, and go ahead and keep that there, and I'm going to put pressure down. Go ahead and just resist me. 1, 2, 3, 4. Rest for 2 seconds. All right, and then up again, more pressure. 1, 2, 3, 4. Rest for 2 seconds. And then more pressure. 1, 2, 3, 4. All right, and the last one, even more pressure. 1, 2, 3, 4. All right, so as you can see, she had a little bit more trouble with the gluteus maximus. That just means that it's more of a weak muscle that we need to activate more. All right, continuing on with the third stage of the corrective exercise continuum with activation, we are going to be doing isometric strengthening, and this is going to be focusing on specific muscles to increase their activation through concentric and eccentric motions. So first we're going to be focusing on the gluteus maximus, and what you're going to do is you're going to be putting your upper back on the medicine ball, and you're going to raise your hips up to a level state for 4 seconds. Once you're up, hold it for 2 seconds, and then go down for 4 seconds. And go ahead and just do that a few times. One, 2, 3, 4. 1, 2. 1, 2, 3, 4, and then back up. The second isometric strengthening exercise that we're going to be doing are the wall slides. So as you can see, she's on her right side because we are strengthening her gluteus medius on her left side. So all you're going to do is you're going to trace up the wall with your foot as high as your leg can go. Hold it, like go up for 4 seconds again, hold it for 2 seconds, and then down for 4 seconds again. Do that a few times. 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. 1, 2, 3, 4. 1, 2, 1, 2, 3, 4. The final stage of the corrective exercise continuum is the dynamic integration movement stage. So what this is going to be doing is it's going to be focusing on the stabilizers and the synergistic muscles involved in the single leg squat. So first what we're going to be doing is we're going to be doing a single leg squat into a press. So what you have is a dumbbell. So with the same leg that you started on, go ahead and go into a single leg squat. And then what you're going to do is you're just going to press that dumbbell up to the air. Do that a few times. All right, and then the last exercise we're going to be doing for the integrated dynamic movement is a single leg Romanian deadlift. So you're just going to be bent over, still with the same leg, bent over, and then you're just going to lift up that dumbbell up to the side. Go ahead and do that a few times. All right, and then that's the corrective exercise continuum that I have for the exercises for her. I'm just going to have her do another few single leg squats so we can see if the torso rotates in or not after. Again, with your hands on your hips. All right, and then, all right, awesome. All right, thank you so much for watching Dr. Seminoff, and I hope you have a great rest of your summer.